I know, so that you've got the general feel of how we're running. So you've got 10 minutes for your submission. Use it how you wish, but we do like to have an opportunity for questions at the end, and there's no need to go through your written submission in detail because we have read it. So over to you. Thank you.
Dear members of the Select Committee, thank you for inviting me here to speak today. I will not just repeat my written submission. Instead, I want to illustrate my stance by taking you to my workplace. So I'm a pediatrician. I'm well experienced in neonatal care and specialized in child protection. I work in the hospital also as part of a group called Maternal Care, Wellbeing and Child Protection Group. Child protection in this context, meaning the care and protection of the unborn child. In my spare time, I'm acting chair of the Crisis Pregnancy Support Service in the Wairarapa. As a family, we do respite foster care and spend part of our holidays at children's camp, caring for children from very dysfunctional backgrounds. We have 4 teenage daughters and a son, Aaron, whom we lost to miscarriage when he was 12 weeks old. I held him in my hand, and he's buried in Austria. So as you can see, babies born and unborn and their mothers play a big part in my life. I'm saying this to show you that this issue here is not just a bullet point for me. It is not just a discussion point. It's not an argument. It's what I do. It's my life. So let me take you through 4 scenarios that could easily happen even in one day at my workplace. So in the morning, a midwife might come to me and ask me and say, Andreas, I have a woman who's 24 weeks pregnant and she needs a specific medication. Can that medication harm the baby? She might be in a volatile relationship. She has an alcohol problem and is a smoker, and the midwife wants me to talk to her about that problem for her sake and for the sake of the baby. Now, I've brought you a picture of a 24-week ultrasound. My wife will hold it up. That's a modern 4D picture of an ultrasound at 24 weeks. While I'm talking to her, I'm urgently called away to the delivery suite, where another mother is giving birth to a 24-week-old baby. So I rush there, and there I will do everything possible and necessary to save that baby's life. Here's another picture of a 24-week-old baby at the neonatal intensive care unit. Every time I look at these little ones, I'm gripped with awe. When I hold this innocent, helpless, delicate, perfect little baby in my hand that is so utterly vulnerable, that is so dependent on me, reacting to warmth and care, but also feeling pain, I feel so privileged. They stay my patients for many years, and it's a joy to see them grow and prosper. After lunch, I'm giving a talk to the midwives on a new initiative called the First 1,000 Days of Life. That's a public health initiative. When do you think the first 1,000 days of life, according to that initiative, start? When the baby is born? No, they start at conception, which makes perfect sense scientifically. And then in the afternoon, I have an outpatient clinic where I see one of my 16-year-old diabetes patients. She's also pregnant 24 weeks. She's in a volatile relationship. She just had a huge fight with her boyfriend. And she asked me where she can quickly get an abortion. Under the new law, I would be forced to show her where she can find a list of abortionists who will kill that baby. I have described the brutal nature of the procedures in my written submission extensively. My wife will hold up a picture of a 24-week aborted baby. It's your choice to look at it or not, just for a few seconds. But this would be the result of your law. I'm sorry, but it doesn't look like healthcare to me. And if you compare it with the last picture, it's easy to see, honorable members, that this is healthcare. And this is not healthcare. I can assure you, I would never tell one of my patients where she could get a service like that. I will never be complicit in any way with abortion. So much for my freedom of conscience. But But I want you to understand, on the same day, it's my job as a pediatrician to care for a 24-week-old baby in the womb of one mother, fight for the life of a 24-week-old baby, prematurely born, teach about the importance of the first 1,000 days of life, starting with conception, and then hand out a list of abortion providers to send another 24-weeker to its death. Can you see the contradiction in this? Can you see the insanity of this? All of them are babies of 24 weeks gestation, and all of them are my patients. It's a scientific fact that human life begins at conception. And honestly, anyone with a brain and anyone with a minimum of intellectual honesty must acknowledge that, and acknowledge that each and every human being should have an equal right to life. Our society agrees that the intentional killing of an innocent human being is wrong. Abortion is the intentional killing of an innocent human being. Therefore, abortion is wrong. It's morally wrong. It's against science. It's against natural law. It's discriminatory. It's against equality. It's most certainly not healthcare for the baby. What about the human rights of the baby? Killing can never be the solution for problems. There must be, and I know there are, other ways, better ways to help women in dire circumstances. This proposed bill fails to give any recognition to the unborn child, my patients. It treats pregnancy almost as a disease, but children are not something that is simply cut away in a medical procedure and discarded. I'm here today to advocate for my little patients who have no say in this. They have no rights. They have no right to life and no basic human right to choose. Please consider the scientific evidence. And most importantly, look with your own eyes what abortion is and does. I plead with you to reconsider your stance and abolish this law. I know it's hard to relate to a topic like this when you hardly see it or hear it. So let me finish with playing something for you that to me is the most wonderful sound in the world. I would like you to hear an unborn baby's heartbeat. I would like my friend Nadine to come. Beautiful Nadine, she's pregnant with her third child and is 22 weeks pregnant. And with a bit of luck, if the little one hasn't turned, we can hear his heartbeat. But I want you to know at 22 weeks, the baby does somersaults in the mother's womb. Okay, just give us a few seconds. You might just have moved away. I heard it for a few seconds. It's okay. You got it? I heard it for a few seconds. Okay, well, thanks for trying. So this is my backup plan. If you just give me a few seconds.
We've just about run out of time, and there are people who
Ruth,
have
I just
questions.
want to finish now. I'll give you 2 more seconds, two more sentences. This is what we just have pre-recorded. I will finish by saying that even though the unborn doesn't have a voice, it does speak. The unborn speaks with its heart. The unborn speaks with its heartbeat. Please remember, in order for any abortion to be deemed successful, this heartbeat must stop. An individual and unique human being with a beating heart must die. And then there's a deadly silence. I thank you for your time and attention.
Thank you. We've got about 1 minute left. So, Nicola, you had a question?
Thanks for your submission. Look, I just wanted to bring you back to, you discussed the concept of a mother on the operating table and you taking steps to save a baby in utero's life. In that scenario, what would your medical ethics tell you to do? Would there ever be a scenario where you would put the mother's life at risk in order to save the fetus's life?
Well, a typical example would be an ectopic pregnancy.
Yeah.
When we have an ectopic pregnancy, though, in order to save the mother's life, we would have to kill the baby. True.
Mhm.
However, I have defined abortion as the intentional killing of an innocent human life. When I save that life of the mother, and that's actually the only chance I have, because I'm done with a chance, even both of them die, or I can save one life. So of course I would save the one life that I can. The unintentional consequence, yes, would be that the baby would be killed.
And
That's
where-
why I say that abortion is the intentional killing of an innocent human being.
Thank you for that answer. And just in supplementary to that, in a scenario where a mother has a baby in utero, are you ever able to do a medical procedure to save that baby's life without a mother's consent? Can you do a surgical procedure without the mother's consent?
You would have to give me a specific example. It's hard for me to imagine what scenario we're talking about.
Are you able to operate on patients without their consent?
Am I able to operate on the mother without their consent? Usually not, except in a case of emergency.
Thank you.
We operate on mothers that are pregnant and operate on spina bifida and other things in utero, but that's a bit of a different scenario.
Thank you very much to both of you for taking the time and trouble to add to our consideration. Our next submitter is the Abortion Supervisory Committee, and we have the privilege of having all three members of the committee to join us today. Please be welcome to the table. We've got Professor Leinfellner